Maternal, infant, and child health.
Fetal alcohol syndrome. When a mother drinks during pregnancy, it has adverse effects on the child's health and leads to the child developing fetal alcohol syndrome. Symptoms of fetal alcohol syndrome include distinctive facial features, including thin upper lip, short nose, and misshapen face, physical issues, low birth weight, slow growth, short stature, developmental issues, learning disabilities.
Burden of disease. It is estimated that around 40,000 children suffer from fetal alcohol syndrome, but the exact number of children with the disease is unknown. CDC studies have found that between 0.2 and 1.5 infants out of every 1,000 live births suffer from fetal alcohol syndrome. Most recent CDC studies have found that 0.3.
Burden of disease/condition. Case fatality. Proportion of deaths within a designated population of cases. The mortality rate for fetal alcohol syndrome is very low. Only in extreme and rare cases does the mother's drinking habits and fetal alcohol
Course of disease. This disease progresses in the child by the mother continuing to drink while the child is still in the womb. The more the mother drinks, the more severe the symptoms and disease will be in the child. An incidence rate is the measure of disease that allows us to determine one's probability of being diagnosed with the disease within a certain period of time. Prevalence is the measure of disease that allows us to determine one's.
define an at-risk population. From 2007 to 2016, 15 to 24-year-old women, pregnant women, had higher rates of binge drinking within 40 days of data collection compared to pregnant women between the ages of 25 and 44. In 2016, 95.8% of pregnant women between the ages of 25 and 44 refrained from binge drinking, whereas this percentage dropped to 94.8.
Our first intervention for fetal alcohol syndrome is more education between the OB/GYN and the patient about the effects of drinking alcohol while pregnant. This is a primary intervention with a target individual. An advantage of this is the expectant mothers are more informed about what may happen while drinking while pregnant. A disadvantage is the mothers are not obligated to follow their doctor's instructions. Our second intervention is substance abuse treatment or therapy for mothers with drinking problems who are pregnant. The intervention we are focusing on is more education between the OBGYN and the patient. The OBGYN doctors could implement this strategy by stressing the importance of sobriety in their patients at the first doctor's appointment. They can have a hotline available for questions after the appointment has ended, as well as informational websites and pamphlets. Evidence-based recommendations. Studies have shown taking prenatal health classes have improved the mental health of women. Due to the classes, they are able to feel more aware as they head into motherhood. Studies show that 88% were more informed about prenatal care, 78% felt more confident in their ability to give birth, 70% described better communication with their maternity care providers. The women in their survey
Evaluation. This could be effective because it can educate women on the risk of drinking while pregnant, as well as make them more comfortable to ask questions to find the appropriate support that they need. Reach. We will reach the intended audience to the OB/GYN offices. Effectiveness. This can be effective if the OB doctor properly informs the patient and provides the needed resources.